Good morning, everyone. The time is 11:32 here on your Monday morning. Glad you're with us on Beyond the Show. I'm Lauren Zenzi.
And I'm Erica Arias. Thanks for joining us. We're having a very important and open discussion about postpartum depression right now. And joining us this morning is Dr. Carla Schnitzline. She's a psychiatrist with Hartford Healthcare's Behavioral Health Network. Doctor, thanks so much for being with us.
It's my pleasure. Thank you for having me today.
Obviously, you're very familiar with the story coming out of Massachusetts, the mom who's been accused of killing her 3 children. Her husband has came out recently over the weekend talking about how quickly the postpartum depression and psychosis has taken over. And so we really wanted to dig deeper into this with our viewers and have more time. What do you think is the most important thing, or I'm sure there's many things that people should know and people should be aware of when it comes to postpartum depression and postpartum psychosis?
Yeah, let's start with the fact that certainly some mild mood symptoms can be normal throughout the pregnancy or even afterwards. That being said, we know that about 10 to 15% of women after the pregnancy may develop postpartum depression, which is probably an underestimate because there's a lot of pressure on new moms, especially, to be that picture-perfect parent right out of the box. So there's maybe a lot of shame in reporting. And, certainly postpartum psychosis is rare, but when it happens is very serious. And so I think it's important that we talk about how to recognize the signs and symptoms of each thing and how to seek help, if that makes sense.
Now let's start at the very bottom, and that is the postpartum blues. You have a baby, you welcome the baby home. Obviously, a lot of stress goes into welcoming a baby home, especially when it comes to your first. Erica and I talked about this at length during our 6 and 8 o'clock hours this morning, that the blues seems to be much, much more common than even postpartum depression. So for people that don't know about the postpartum baby blues, walk us through exactly what that is for any new moms that may be watching right now.
Yeah, so immediately after birth, or even sometimes just before, we might get some mild depression symptoms. Sometimes it might be difficult to sleep. Sometimes we're feeling a little bit sad. Typically, these symptoms are very time limited and start to get better after some of those hormonal changes that happen during pregnancy and immediately postpartum start to reside. Certainly, we're at greater risk for those baby blues when we're not getting great sleep, which of course a lot of new parents don't, and there's other stressors. But again, it's mild and it's time-limited depression immediately after the birth.
And talk about the warning signs when it's more than just the baby blues. What should people be looking out for? Not just new moms themselves, but also spouses, relatives, parents, aunts and uncles, because it really takes everybody to sort of be aware and to check on the people that we care about.
Yeah, absolutely. So sometimes things get beyond just those mild baby blues. And so people can kind of start to experience a profound sense of depression. Some warning signs for it might be that, new moms are not taking care of themselves. They stop showering, they stop, engaging in the way they normally would. Sleep gets very disrupted to where, it's even beyond just the waking up with the baby for breastfeedings, changings, etc. Certainly people can be more irritable and agitated. And, we know that we're really kind of seeing some red flags when mom's not engaging with baby, perhaps neonatal visits start to fall off, other kind of warning signs that this might be getting worse.
As far as more of warning signs, can we talk specifically about thoughts? Maybe if moms having the thought of, I'm not connecting to my baby, I don't love my baby, I don't want to be with my baby. These are all really difficult feelings for moms to process, but that is a sign that something is
Not
deeper.
right.
It's more than just the baby blues, right?
Absolutely. It can be a postpartum anxiety or depression. And, it's important that when we start to notice those early signs, like maybe I'm not connecting in the way I'm hopeful for, or maybe I'm not feeling like I'm a good mother, that we start talking to either our primary care provider or somebody in behavioral health about what the next steps might be before things take a turn for the worse.
Now, I had a question from Karen in Torrington. She asked what to do if you have a family member that you think is suffering from postpartum depression, but whenever you ask them, they say that they are fine. When is the time to really step in and say, you know, I've really noticed a change in your behavior. I've noticed, you don't want to call them out, but at the same time, you want to make sure if they do need help, that they get the help that they deserve.
So certainly it's always good to check in early and often. And certainly early intervention is going to prevent worse outcomes in the long run. What I tell people is that when we're making those interventions and talking to family members and friends about, hey, I've noticed a change, normalizing it. Normalizing it by saying, hey, I've noticed this change. It's very normal for new moms to be going through the baby blues. You know, certainly if you've experienced it, kind of empathize with the person and talk about perhaps your own experiences if you're comfortable, and really start that dialogue with them. Now, if you think there's danger, you always want to involve somebody who can help immediately.
Now, I just want to let everybody know, if they're watching on Fox 61 Plus, you can also join us on Facebook, and that's where you can ask questions. If you have a question that maybe pertains to your situation or a relative or a friend, we can get that question out to the doctor. So just to let everybody know, they can go to Facebook. I do have an anonymous question here for you, doctor. The writer says, I have a niece who lives with her husband in Colorado, many, many miles from any family. They just had a baby a month or two ago. How do I check on her without implying that I'm worried or nervous about her postpartum health?
So depending on how frequently you have contact with a loved one you might be worried about, you know, you can start bringing it into the conversation as, hey, how are things going with the baby? Asking her about her self-care. Hey, are you sleeping? Are you finding that you're getting enough to eat? Are you still able to do the things that you'd enjoy in kind of a non-threatening way? Like, I know before you had your baby, you were doing a lot with cooking. Are you still able to find time to do that? Kind of subtle ways of checking on those symptoms that could be indicative of depression. And if you notice that things are changing, like they say, yeah, I'm really not sleeping, and it's getting beyond what would be normal, then saying, hey, have you ever considered it could be something more? Engaging in a non-threatening way with things that you know could be affected at baseline, if that makes sense.
And would it be wrong to come out and even say that you're concerned about postpartum depression or the baby blues? Because I think a lot of the stigma still surrounds that, because people are afraid of talking about it. We know that about 3 million women suffer from it, but that's just what's reported. So many women don't report it because the stigma is still attached to it. So it's probably a good thing to call it what it is, right?
Absolutely. It's never wrong to ask, do you think you might be struggling from the baby blues? Do you think this might be depression? And express that, hey, I'm worried about you and I'm here. And I'm happy to talk with you about it. And I absolutely agree that, you know, the more we talk about these things, the more we normalize them, the more people are going to seek help, because they understand that it's part of what can happen after the pregnancy.
You know, and something that really shocked me is that with the tragic situation that happened up in Massachusetts last week, this woman, Lindsay, her husband, put out a statement on their GoFundMe page. And one of the main things that I took out of it, not only did he talk about his children and how incredible they were and how much of an impact and how sad he is, he had said, quote, I want to ask all of you that if you find it deep within yourselves to forgive Lindsay as I have. The real Lindsay was generously loving and caring towards everyone, me, our kids, family, friends, and her patients, because we know that she was a labor and delivery nurse. The very fibers of her soul are loving. All I wish for her now is that she can somehow find peace. Let's talk more in depth about postpartum depression, psychosis, when you end up becoming this person that you aren't usually, because this could happen to anybody. You don't need to have underlying mental health issues. You could be totally normal before you have a baby, and then this very unfortunate disease takes over. Talk about the depths of it, because I don't think a lot of people understand just how severe it can become.
Absolutely. No, when we're dealing with postpartum psychosis, you know, a person has experienced a significant break with reality. They may be having hallucinations, hearing things like voices telling them that they're an unfit mother or that somehow their children are in danger. They may experience delusions, and those delusions can cloud their judgment, cloud their insight. They may have significant mood dysregulation where they're more impulsive. They may think that somehow they're invincible or have powers. And really, when you're in the throes, you're not having good insight and judgment. You're not always the person who you have always been. And that puts you and others at some risk. I do want to say, as much as we're talking about infanticide and deaths of kiddos, the other significant concern during this period of lapse from reality is the fact that women who are suffering from postpartum psychosis are at greater risk of self-harm and suicide.
Yeah, that's a really important thing to keep in mind. And that's why I think it's so important for the people surrounding that mother to be really in tune and really pay attention, which can be hard when you have a new baby in the house. You know, you're trying to do things, you're trying, maybe a spouse is still working or has to work, and you're trying to get as much sleep as you can. Everybody's tired, but you really have to take that time and look closely. Almost even like, if you start to be concerned, would you maybe take a diary, keep a journal, ways to really stay on top of these things?
Yeah, absolutely. Sometimes behavioral changes can be subtle, but if you start to notice it becoming a trend, you have data to help you intervene, especially if the behavioral deviation is so significant from that person's baseline. And it's absolutely an act of love to try to get somebody help.
Right.
But yeah.
I think what a lot of people don't understand is this is a chemical thing. This is a chemical imbalance that's happening within the brain, within the body. Can you talk a little bit more about that?
Absolutely. So again, as we go through a pregnancy, our hormones change. And those hormonal changes can affect the neurotransmitters that affect our mood, that affect our memory, that affect everything we do and think on a daily basis. And then we give birth, and all of a sudden, those hormones change in levels again very suddenly. And those have impacts to those other biological systems that really drive postpartum depression and psychosis. And I think we don't talk about the fact that it's biological, and that's a disservice. Because then there's this false belief that it's somehow a personal failing, which it is never. It's a biological condition that responds to medical treatment.
Which I think as a whole, when you think, if you do end up becoming a person that has these thoughts, how can I not love my baby? Things like that. How can you not feel guilty? How can you not feel a sense of shame? But having the courage to understand that this is not your problem and your fault, I think is one of the biggest things. Now, you just mentioned diagnosis and treatment. What is the diagnosis process? I know Susie from Rocky Hill just wrote to me on Facebook and asked, what is treatment for this? What does that look like? I can understand that it's probably not a one-size-fits-all.
It's definitely not one size fits all. And so let's talk about first kind of that diagnostic procedure, because diagnosis drives treatment. And so when we're diagnosing someone, we sit down with them and we conduct a very thorough interview where we're gathering information about their past, what might predispose them to certain conditions, what might be helpful factors in their trajectory. And after we gather all that information, we sit down and have an informed conversation that this is postpartum depression. And we have a lot of options. Now, where it is biological, we may use certain medications that affect serotonin, norepinephrine, to help correct that imbalance. And certainly we do a lot of informed conversations if a woman is breastfeeding or has some other consideration where she's reluctant to take medications. Sometimes, especially in cases of postpartum psychosis, we're going to need emergent and immediate help on an inpatient setting for acute stabilization. Again, it's usually time limited. It can feel very surreal or scary in the time, but people do get better and have very successful outcomes.
Now, these children, this situation coming out of Duxbury, Massachusetts, and the fact that the husband put out a statement at length about his wife, about his children, he mentioned that he has forgiven his wife. What comes to mind when you see that? Obviously he has suffered such significant loss of not only his children, but also, someone that he has been with for a very long time. How do you go about being on the other side, being a family member, a husband, a relative? How do you go about understanding and being supportive when something so significant, something so scary is happening, and being able to say that you forgive them because you know that it's not who they are?
I think that can be very challenging to process that grief, to process that hurt, and come to a place of forgiveness. I suspect this gentleman has a very long road ahead, and it takes a lot of courage to process those feelings and come to that place where he's forgiven her. And I think it models that he understands that this is a significant biological issue, and he's giving permission for other people, in a sense, to better understand the condition and have empathy for those who might be struggling.
Now, in that letter, we learned that his wife, Lindsay, she was a delivery nurse. So she worked in the hospital. She was very familiar. You would think she'd be very familiar with the signs of postpartum, and then also surrounded by others who are very familiar with the signs of postpartum. What do you think needs to happen for it to be detected more? I know a lot of times there's checklists when you go to your postpartum appointments. Lauren and I discussed it. You fill out a form, how have you
Even
been
at
feeling?
the pediatricians.
Right. And that's one of the things that's been done in the health industry. What else do you think needs to be done, could be done, should be done to prevent things like this from happening again and to promote more detection, earlier detection?
I think that we need to screen, number one, at every visit, even before someone gives birth, and just have very honest conversations with our patients that postpartum depression is a real thing. The more we talk about it, the more it normalizes it. And we know that if we ask about it enough, people will develop a certain comfort to talking about us to us when things become out of control. We also know that there are things like new parent support groups. And so pediatricians and primary care physicians having those resources at their fingertips to make early referrals can go a long way.
And it's important for women to keep in mind, they might think, oh, I'm fine. I've not struggled with mental health in the past. My family doesn't have a history of any mental health issues. But that doesn't matter, when you're talking about postpartum. It can happen to anyone, all socioeconomic backgrounds, all ages, whether you've struggled in the past with mental health or not.
Yeah, absolutely. It can happen to any of us. I saw an article recently where another woman was talking about her experiences with postpartum depression. And she said, I never thought this would happen to me. And she felt lucky that people around her talked to her about the fact that she was experiencing signs and symptoms and helped get her the treatment she needed. But yes, this can happen to anyone.
Now, Lauren and I have been talking about throughout the morning. I'm wondering if you could share maybe some of the stories, obviously with keeping people anonymous, their journey as far as what happened and how they came out on top. If someone's watching right now and they might really be feeling down in the dumps with it and not sure, about the light at the end of the tunnel, can you speak to them from your experience and from people that you've met and the stories that you've come across in your experience?
Yes. I've frequently had primary care physicians, OBGYN physicians, and pediatricians say, hey, I have a patient who might be struggling with postpartum depression. They're a little nervous to talk to a mental health worker, but are willing to give it a try. And so at that first visit, I'm sitting down with folks, getting a sense of what's going on and doing a lot of normalization, helping them recognize that this is a stressful time. There's a lot going on. We're not sleeping as well. Our hormones are changing. Everything around us is kind of in flux, and that it's okay to have certain feelings. And sometimes those feelings don't resolve and it becomes depression. And from there, we start talking about what the next steps are, whether it's individualized therapy, whether it's medication, whether it's a combination of the two. When you normalize it, people tend to better hear that they might be struggling with this as well. And when they do undergo treatment, medications, and therapy, they start to feel like their normal selves. They reach a baseline where they have energy, that they're having good bonding with their child, that they're not feeling this shame or sense that I might not be a good mother. And as they start to feel that way, we recognize it in session and we talk about the progress they've made and say, hey, look how far you've come. And that's the journey that anyone can walk with treatment.
Now, is there a way that someone could anonymously get help or maybe just talk to somebody? I'm sure there's a hotline, right?
There is the 833 Help for Moms hotline. And so it's a new kind of maternal health hotline where moms who might be struggling with feelings of depression, anxiety, anything at all can reach out and phone somebody to talk to.
And I think that's so important. I mean, Erica and I were talking all morning, and like you have said, you know, if you are out there and you are watching this and you feel like you are alone, maybe this is your first baby, people always say to you, how can I help you? What can I do to help you? Go take a nap and I'll watch the baby. And you almost feel a sense of guilt. Really do. Go take the nap. It really is so important to take care of yourself as well, because I think we sometimes get suckered down and we get sucked into, you know, not sleeping, not eating, when in reality, these babies need you to be at your best. And I think sometimes mothers and dads, moms and dads, we put ourselves to the wayside. You forget about how important your own, not only mental health, but physical health is. And you're not alone. You know, Erica and I were talking this morning, doctor, and we were saying, when I had my first son, and I know you were talking about when you had your first child as well, you just felt sad.
Yeah.
There was a time when my son was a newborn, I would just sit there, I would go in my room, my mom would come over and say, go take a nap. I would want to sleep, but I would sit there and I would just cry.
Yeah, it's just this incredible urge to cry.
Yeah.
You get weepy and you just
You
feel
don't know
really
why.
down in the dumps, and that's the typical baby blues, you know, what we were talking about. But as Lauren, as you were saying, take that nap, you know, if you can. But if you're finding that you can't take that nap because you can't stop your mind, right? Doctor, that's what you're saying is that's one of those warning signs.
Yeah, absolutely. If you just can't turn off your brain for a few minutes, it can be a warning sign. So heed that warning and make sure you're taking good care of yourself too. And sometimes that means some assistance for mental health.
Yeah, and for those folks who are watching, you were just mentioning it, you're not alone.
No.
There are so many women struggling with this right now in varying degrees. You are not alone, so please know that. And as you were saying, there are a lot of resources out there. There is help.
I want to say that hotline one more time. It's 1-833-HELP-4-MOMS. This is an anonymous network. I believe you can call in. It's a 24/7 free confidential hotline for pregnant and new moms in both English and Spanish. So this is a great opportunity if you are experiencing a little bit of a scary time and you don't want to reach out to maybe your parents, your husband, your loved one for that help. This is a network of professionals, and just having someone to talk to, I think, really does make it better, especially when you have a new mom to talk to as well. That's why having that network is so important.
Yeah.
Or else it's so easy to just become lonely.
But the important thing is not to be afraid to reach out.
Yes.
And that's why we're doing this. That's why we wanted to have this discussion, to bring more light to it so that people don't feel alone. That so many people out there are struggling with this as well. Before we go, I just want to ask you one more question as far as what you think should be done as far as bring light to fathers or spouses or partners and what they can do. Of course, we hear a lot about it as women, as moms, but as new fathers, should there be more education for them as well, specifically geared towards them?
Yes, I think so. I think there need to be more resources for both parents overall. I think that, you know, the new parent support groups not just address mom and maybe what's going on with her, but dad as well. So making sure that doctors understand what resources might be available for dads, and primary care docs check in with your new fathers. Say, hey, how are you doing as well? And remember, dad might need a break too. And so offering him a nap from time to time might not be the worst thing.
Everybody needs a break. I don't care who you think you are. You need a break every now and again, and you deserve a break. Welcoming a baby into the world is not an easy task, and it really does take a village. So take advantage of having a network around you. And if you don't have a network, there are so many amazing moms groups and
Yeah.
things like that, resources out there for new moms.
That's the thing. I mean, Facebook has so many mom groups, and you might not want to do it. You might feel awkward initially, but chances are those other moms did as well, and you're really going to feel so much better. It's one of those things where you don't want to, you know you should. So
You
that-
meet up with a group of people at a park,
and then you're like, I'm so
not
glad.
knowing.
I'm so glad I did this.
Yes.
You know,
It really does
helps.
make a difference too, because in that small network of people, you quickly realize that you're not the only one, even though it could feel like a very lonely thing. It really does make a big difference.
Now, Doctor, before we wrap up, just want to give you an opportunity to maybe say anything that we didn't ask about before we wrap it up here. Anything specific that you want to say to our viewers?
Absolutely. Again, I really want to just take this opportunity to reiterate what we've talked about, how so many women can be affected by depression. You're not alone, and sometimes taking that first step towards help seeking is scary, but when you do, you can just feel so much better.
There is a light at the end of the tunnel, and it is with the right help and dedication from family and friends and clinicians, you can get to the end of the tunnel and have a beautiful life.
And the more people who ask for help, the better we'll all be. You know, we have to let people know that we need help. I mean, that's the whole issue with mental health and the stigma that still surrounds that, is that don't be afraid to ask for help, whatever it might be.
It's okay not to be okay.
Well, Doctor, thanks so much. We do appreciate your time and all your insight and information. So very helpful. And I know it's going to be very helpful for our viewers as well.
And we know that this is on Fox 61 Plus, also on social media. Continue to write in your questions because we would like to continue this conversation. This is not a conversation that ends today.
Absolutely. Thank you so much.
Appreciate you, Doctor. We
Thank
appreciate
you.
everybody at home that took the time to watch this today.